Hi YouTube, this is Stacy. I just thought I would check in with you guys again. It's been about a week. I just want to give you, a status update. I'm going to try to do weekly updates from now this point. Been through quite a bit in the last few months, so just to kind of give you the statistics in the beginning. Gastro bypass I had of December of 2010, 2009. Yeah, 2009. I'm 2.5 years out. My starting weight was 325. I am typically down to about 155 to 165 pounds. I fluctuate about 10 pounds up and down. For the most part, I went from about a size 24, 26 down to a size 9. Perfectly happy with that. Don't want to go. Really, I actually don't want to lose anymore. Don't want to gain anymore. My last post was about C5, C6 anterior distectomy fusion surgery that I had on my spine. That's where you find this lovely little scar that I have here. I had surgery February 13th of 2012 for that. Since then, I've been dealing up and down with a lot of nerve damage. These wonderful 3 little fingers, I have absolutely no feeling from my surgery in. And the conclusion of my surgery came from possibly bone degenerative disease. A lot of it, I think, had to do with when I was heavier. I was about 325 pounds, so it's a lot of body mass to put on your bones. And over the years, roughly, I'm only 37 years old, so over the years, I think my spine and my disc just kind of wore down from that excess weight for so long. And then once I got, to a normal weight, I think my bones just had already by that time given up. So the problem with gastro bypass, and I wanted to talk a little bit about the spinal surgery, is the problems I had with gastro bypass and actually my new surgery with having my spinal surgery is you can't take any kind of anti-inflammatories, so such as Aleve, ibuprofen, anything like that I couldn't take. So after my surgery, I just swelled up like a balloon. I had to take all these different pain medications and stuff, and found that my little pouch couldn't even take pain medication. So morphine, codeine, long-term, short-term, any of my pain meds, basically, when I ended up in the hospital for my fusion surgery, I ended up back in, I was released after about a week, or actually it was about 3 days. Then I was re-entered back into the hospital roughly a week later, for severe dehydration and just severe nausea and pain obviously associated with my neck and my spine. And a lot of that had to do with I was so inflamed, but yet I couldn't take anything for it, other than I had some patches on the outside that kind of helped numb the situation, but that didn't really help. So they over-empowered me with all these pain meds, and I got so sick from the pain meds that after a week that they had me in the hospitalization the second time, they discharged me about a week and a half later, and not 3 days later I ended back up again in the hospital and readmitted for severe case pancreatitis. So you really, really have to be cautious on medications with your pouch, and for me, I'm just super sensitive with anything that kind of comes in. So my little pouch, I end up having to take nausea meds. I'm pretty much getting off of them now, but I was on them up until about 2 weeks ago. As far as the spinal surgery, I have a lot of pain in my left shoulder blade that I'm working with an occupational therapist, physical therapist, a spinal rehab, pain clinic, my primary physician, and my neurosurgeon. So a lot to be said with gastro bypass along with this type of surgery. I had asked my surgeon if he had ever had any surgery with somebody like this with gastro bypass before, and I was his first patient. He said in his residency he had one person, but everybody kind of reacts a little bit different. Everybody's body is a little different, but I just highly caution people out there about the surgery. And unfortunately, I had a protruded herniated disc that was pushing into my spinal cord, so I had no choice basically but to have surgery. I had an MRI basically on a Wednesday. I saw the neurosurgeon on a Friday. By that, they put me on bed rest for 2 days, and by that Monday I had surgery. So it went very, very fast. My symptoms basically were, for a couple of months, I had kind of woke up with a crook in my neck and thought I just kind of slept funny. No, didn't sleep funny. It was bone degenerative disease that caused this issue. And then I ended up seeing a doctor that happened to be a DO, and no offense to DOs, he decided that at first that he just thought it was all in my muscles, so he talked me into manipulating me, which then created a lot of inflammation, which then I couldn't take any anti-inflammatories, so it was a mess. But I'm on the ride for positive and only upward from here. So I am going to be back for a while. So any of you that have questions about just general eating, general surgery after a gastro bypass, or just trying to get, if you're just starting with gastro bypass, give me a holler. My husband just had it surgery in, he's 1 year out actually, and altogether he's lost 95 pounds. He was a severe diabetic, basically taking mega shots every day, long-term, short-term, plus metformin, high blood pressure, high cholesterol, you name it, he had the issues. He was also born with an enlarged heart, so he had some heart issues anyways. But since the gastro bypass, he is off all of his shots. He basically still does take the metformin, still has to take a blood pressure med, but a lot of the blood pressure meds due to his heart condition from when he was born. But as far as just from a diabetic standpoint, I was pre-diabetic myself. I take absolutely no medicine for that. I take medicine now due to all my neurosurgery issues, but vitamins are pretty much all I take, and some Tylenol here and there. But my husband has came off numerous medications. So for you, those that are diabetic out there, this surgery is a tool. I'm not going to say that it's a weight loss guarantee, because I've had a couple of friends that have had the surgery and actually gained the weight back. So it is possible to become large again. I have a friend that had the surgery, and not a year and a half later, she's bigger than she had before surgery. Me, I have a sweet tooth. I have a chip. I love chips, but I do try to minimize everything and just eat in very, very small portions, so you can still have what you want. Just eat small bits of it. So when I do have a candy bar or chocolate bar, I eat those little mini ones, and that satisfies my hunger. So my husband, on the other hand, he's been having a little bit more difficulties with wanting to eat more and more. So it is a mindset. So he did that 5-day pouch test and felt that it worked a little bit, but he's going to retry it again because he ended up getting the diet wrong on the second and third days. But he did lose about 6 pounds altogether on that. So anyways, for now, I'm going to say ta-ta for now, but check back with me if you want some information. I have a better computer now, so you can see me a little clearer. But any questions, holler at me. Thanks. Bye.